But there is also another warning from health officials about a new possible rare disease outbreak. It is called monkeypox. Joining me right now is Dr. Kavita Patel, former Obama White House policy director. She's also an NBC News medical contributor. So we've seen a couple cases of monkeypox in Massachusetts, now a case here in New York. What do we need to know about it?
Yeah, Katie, what we need to know is that it's much rarer compared to a lot of the things we've been talking about lately, such as COVID. And in particular, we still need a bit more information about why we're seeing such wide geographic spread. Now, the fact that we're seeing not just the cases in Massachusetts and New York, but there's a probable case in Australia, we have cases in Europe and Canada and other countries, that does mean there's probably some low level of community spread that we could anticipate. So I'm just saying this to warn people, we will likely see more numbers. That should not make people panic, but it should make people, if they have any unusual skin signs or something that is kind of worrying them about their travel in the past to an area where they have heard about outbreak, they should talk to their doctor. And then here is some reassuring news. The smallpox vaccine, which we haven't needed to use since the 70s, Katie, actually does have some protection to protect against this. So we have tools of defense and we have some treatments that we can use, but it's about getting diagnosed. And that's when people should start to present to the doctor. But it is not like, I don't want to even try to compare it to COVID. There's no comparison, but we're talking about two different things. And I'm much more worried about the COVID numbers we're seeing, to be perfectly honest.
I want to ask you about COVID, but I do want to know, how does monkeypox spread?
Yeah, so it does spread through direct contact, prolonged contact, usually large droplets of transmission or contact of body fluids. That's not just the casual, just being around someone for a couple of feet. It has to be pretty direct contact. It can live on surfaces, Katie. So we do know of cases of transmission from objects. However, again, because the disease, the majority of people who get this have a self-limited illness. They do not proceed to some of those graphic images that we've kind of seen flash across the news. But in case you are in that percentage where you've had a history of contact with an individual or travel in an area, we'll learn more about what that means from the CDC. That's when I would definitely recommend just calling the doctor first and seeing if there's an evaluation. We have testing for it, treatment, and fortunately a vaccine if we ever need